Hello everybody. What is akathisia? Akathisia is a neuropsychiatric syndrome and movement disorder that makes it difficult to sit or remain still due to an inner restlessness. The name comes from the Greek word akathemi, which means ability to sit. Akathisia is primarily caused by prescribed medications. The most frequent offenders are antipsychotics, antidepressants, anti-nausea medications, and antibiotics like fluoroquinolones, but it can also be caused by many other medications as well. It is also common in the benzodiazepine withdrawal, especially after long-term use. It most often occurs when starting, stopping, or changing the dose of a medication, but it can occur at any time during treatment and even months after it is discontinued. A few health conditions have also been linked to akathisia, including Parkinson's disease, encephalitis, which is brain inflammation, and traumatic brain injury, TBI. Akathisia is far more common than has been reported in the past and remains dangerously underdiagnosed and underreported today. So what causes akathisia? Scientists don't know the exact cause, but they think it's due to certain medications blocking dopamine receptors in your brain. Dopamine is a neurotransmitter that plays a role in many important body functions, including movement. The blocking ultimately results in unwanted, involuntary movements. Healthcare providers classify akathisia in a few ways based on its time of onset and duration. The symptoms most commonly associated with akathisia include the following: intense physical restlessness with a need for constant movement, such as pacing, rocking, foot tapping, hand wringing, and shifting position in a chair. An overwhelming sense of terror, which has also been described as chemical terror. This is so pervasive that the person actually feels as if they're experiencing a terrifying event, a feeling often described as wanting to jump out of my skin, extreme agitation, impatience, and irritability, suicidal and/or violent impulses, depersonalization, derealization, which is feeling disconnected from the body as if observing it from the outside, or a sense that the world is unreal, similar to living in a dream. Separation anxiety or monophobia, and agoraphobia, a need to be near safe people and places at all times due to the terror. Racing thoughts and pressured speech. Vocal tics, example throat clearing, grunting. Subjective physical sensations such as electrical zaps, buzzing, vibrating, burning, bugs crawling under the skin, etc. Hypersensitivity to light and sound. Executive dysfunction, impulsivity, disorganization, inattention, emotional dysregulation, and insomnia. Now, I have heard many times people question the legitimacy of akathisia. And even though I don't have it, I can tell you without a doubt that it is a legitimate illness because it has an ICD-10 code. Those aren't easy to get even for legitimate illnesses. I know. I just recently went through this for the adverse effects of fluoroquinolone antibiotics. So, in recognizing the legitimacy of akathisia, there are a couple things I wanted to note. ICD-10 codes for mental health disorders usually start with the letter F. The ICD-10 code for akathisia starts with a G, okay? So for people that say it's not real, it's in your head, the ICD-10 code in and of itself says that that's not true. The code is G25.71 for drug-induced akathisia. Here are some other key points of legitimacy. Akathisia is a neurological disorder composed of both neurological and psychological symptoms. Motor symptoms can be variable, briefly suppressed, increase with attention, and decrease with distraction. Motor symptoms may increase with physical and/or psychological distress. Excessive movements are not always evident, and due to the above-noted motor characteristics, akathisia can easily be misdiagnosed. The importance of an accurate and swift diagnosis cannot be stressed enough. It is crucial to consider a self-diagnosis, even when a patient exhibits no objective signs. Failure to do so and an alternate misdiagnosis are resulting in unnecessary involuntary hospitalization, forced drugging with medications that worsen the akathisia, loss of family support, abandonment, homelessness, and a much greater risk of suicide. Here are some more common misdiagnoses: the worsening of a mental illness, new mental illness, generalized anxiety disorder, panic disorder, personality disorder, bipolar disorder, attention deficit hyperactivity disorder, restless leg syndrome, health anxiety, functional neurological disorder, FND, somatic symptoms, and factitious disorders. Patients with symptoms severe enough may easily meet the criteria for these disorders until they find a doctor who recognizes their akathisia. Akathisia is very common in benzodiazepine withdrawal, especially if prescribed long-term. It can also occur with tolerance and between dosages. To these patients, even one missed dose can cause significant worsening. Reports among thousands of support group members suggest slow tapering of psychotropic medications, and subsequent abstinence may be the most effective long-term treatment. The medications known to cause or exacerbate akathisia includes all antipsychotics and antiemetics that deplete dopamine, as well as most classes of antidepressants, as they can indirectly do so as well. There are published reports of akathisia due to many other pharmacological and non-pharmacological agents, and akathisia can persist for many years or after an offending medication is discontinued. Please see the following list. Hope this video explained what akathisia is, that it's a real medical condition, and is usually caused by medications. One of which that I have to call out because I'm an advocate for fluoroquinolone toxicity is fluoroquinolones. People can develop akathisia after taking fluoroquinolone antibiotics. That's all I got. Thanks, everybody.